All right, so welcome to the final COVID training that's scheduled. I appreciate you taking time out of your day to join me today. I'm going to share my screen here, get us started with our slides. So if somebody would give me a thumbs up that you can see the slides. All right, I see one thumbs up, so I'll take that as a good sign for everybody. So one of the struggles with Zoom is being able to see the slides and monitor the participation in chat. So let me zip through the slides and then I'll stop sharing so I can then see the chat, but preferably have you unmute so you can ask your question and I can get a response that way. So welcome, I'm Erin Foley. I'm the Vice President for Student Affairs and the Dean of Students, and have been leading our campus response to COVID for the last 19, 20 months or 20 years is what it feels like. But I hope you're all very excited to start classes on Wednesday. We're glad to have you back, and we need to make sure you're up to speed with how we're operating under COVID for this year. So here's an overview of what I will talk about. Some lessons learned from last year, fall overview, requirements and responsibilities for students, how campus operations will look, and some accountability pieces. Let me first start with the picture there. It says safety first, and it's a question. Yes, safety is first. Safety has always been, along with our health and wellness, the top priority for campus, whether it's students, faculty, staff, it's even visitors. Safety first is how we're approaching this. So let's talk about what we learned from last year. You know, last year, we'd never gone through a pandemic before. We never knew what to expect, how rapid things might change, if we'd have to move in one direction and then put on the brakes and change directions, pivot, maybe even go back to entirely remote. Thankfully, and I think it's because everybody did what they needed to do, we were pretty effective in maintaining a few number of cases, certainly nothing like I anticipated this time last year. People were flexible, they were vigilant in doing what we asked them to do. And as a result, our COVID cases, we had them, yes, but we certainly didn't have the numbers that we could have had. In fact, our transmissions were 1 in classrooms, 1 in the lab, and 1 in a roommate to roommate in campus housing. You know, when you think about it, that's pretty remarkable. And I think that's because we did a lot of different things and we all worked together. We also learned that transmission really occurred off campus. So when students went to social gatherings, went to bars, went to parties, holidays, family gatherings, when you came back, you brought it back to campus. So transmissions weren't happening from person to person on campus as much as people were doing things off campus, maybe letting their guards down a little bit and bringing COVID back to campus. So what we're doing is informing our plan this year with what we learned last year, along with the guidance that we continually get from OHA, Oregon OSHA, the CDC, local public health officials, and anybody else that has wanted to weigh in on how we should operate. So we've done that, and we've created the return to campus plan for fall, which is posted on the Oregon Tech main page under the coronavirus. All right, so quick overview. I hope you all know that classes start on Wednesday. Many returning students are not used to having classes start in the middle of the week. Typically, we start on Monday. This had been the plan to change to a Wednesday fall start for years, but last year the entire fall calendar was changed because of COVID, so we actually started on a Monday. So this is the first year that we're actually starting fall term on a Wednesday. So this Wednesday, September 29th, first day of classes. We are working under the operations of all classes and labs in person at both the Portland Metro and the Klamath Fall campus. If there was a class always scheduled to be taught online, then those classes will obviously continue to be online in format. In terms of campus services, we have staff back on campus, ready to serve. I'll talk more specifically about what that looks like in a minute. I'll leave it to say that we have regular operations back on the Klamath Falls campus for campus dining and housing. And the student athletes for fall sports especially are very excited that so far they've been able to return to campus for practice, and many have already started their conference competitions. We're doing quite well, and they are following their own requirements under the Cascade Conference or the NAIA. All right, so if you remember last year attending one of these trainings, we talked about our prevention measures with the metaphor of Swiss cheese. So if you think of a slice of Swiss cheese, you envision maybe a slice, and within that slice, there's some holes, right? That's what Swiss cheese is really known for. So if you think of each one of these prevention measures as a slice of Swiss cheese, we know that each individual prevention measure is not as 100% effective as we would like, right? There's a hole in it. So what we really need to do is look at each one of these prevention measures as a single slice, but just like Swiss cheese, when you stack up multiple slices, eventually those holes get covered partially by another slice, right? So same approach here. If we continue to do all of these things, then we're going to continue to reduce COVID and the spread as much as possible. So we will continue to encourage regular hand washing, cover your mouth and sneeze. So if you take off your mask to sneeze, which is what I do because I don't want to sneeze in my mask and then wear it, I sneeze into my sleeve. Same thing, that's perfectly fine. Just put your face covering back on. The self-assessment, I'm going to spend a little bit more time talking about because of the need to do that. Last year, we had the 6 feet of physical distancing as a requirement. This year, that's not a requirement, but we want to still encourage monitoring your physical distancing with others, encouraging 3 feet. That's what K through 12 is doing. Makes sense. It's pretty easy, certainly easier than the 6 feet that we had last year. Keeping it clean, we'll talk about what that means in academics here in just a minute. So 2 requirements that we have in place currently, and with COVID, things change. These may change. Maybe number 1 will change more likely than number 2, but the first requirement is the face covering requirement. Anytime you're on campus indoors, a face covering is required, with the exception of whether you're in a designated eating location and actively eating or drinking. Outdoors, face coverings are required if you're in a large activity. Like yesterday, we were doing some orientation events, and students that participated outside wore their face covering. The second requirement is our vaccination requirement, which is in place for all students, faculty, and staff to either be fully vaccinated or complete an exemption. And the exemption can be for medical or non-medical reasons currently. That deadline was September 1st, so I'm hopeful that the majority of you on this training have already completed the vaccination requirement by either submitting your vaccine dates through the student health portal or one of the exemption forms also through the portal. If you have not complied with the vaccination requirement by the first week of classes, sometime early next week, we will be placing holds on your student account. So you won't be able to drop or add classes. You won't be able to register for next term. And there's some other things that a hold will prevent you from doing. So don't risk the chance of getting a hold. Please become compliant with the vaccine requirement. A special note here that if you have filed an exemption and now because the FDA has fully approved the Pfizer vaccine and you have reconsidered and now are willing to get the Pfizer vaccination, you can simply go in and update your status with the student health portal. If you have any troubles doing that, you can call student health. All right, next slide. We have some responsibilities. These are very much the same as last year. Most importantly, we want you to stay current with what's happening around COVID on campus. And you do that by reading emails regularly, looking for announcements. We'll often post things on the Oregon Tech app. It's usually the Saturday morning email that I sent out all of last year weekly, where you get the most information. So please watch for emails, watch for other information, listen to announcements from faculty, and please stay current. With staying current is staying compliant with any of the expectations or the changes in requirements, the new ways of handling campus operations. That would also be really important. Should note that any non-compliance with these requirements may result in a student code of conduct violation. Number 3 is really important, whether you're a Portland Metro student or a Klamath Falls student. If you have any symptoms, an exposure, or you test positive, please call student health for directions. They will work with you to tell you what you need to do. It also starts the process of letting faculty members know that you'll be out of class. All right, number 4 is kind of a rehash of the previous slide with the prevention measures, but let me talk about the daily health screenings in a little bit more detail. So we want students to complete the daily health screening via the Oregon Tech app anytime you come to campus. So if you don't have class on Wednesday, you wouldn't have to do the screening unless you're coming to campus to use a service or participate in an activity, and then you would need to complete it. But if you're staying away for the entire day, you don't have to do the screening. So if you don't have the Oregon Tech app, you need to go to your app store and download the app. Look for the hoodie icon. It's the one that says Oregon Tech. It's free. Download it. Then you'll want to create your login. And part of that is making sure you select the right campus. So there's a Klamath Falls option and a Portland Metro option. And then select that you're a student user, because that's where the daily health screening is. If you select faculty or staff, you won't see that tile. So when you click on the, once you create your account, then you'll see this screen, and it says right at the very top, My Daily Health Pass, and then right below it is the daily health screening. That's what we're going to talk about doing every day. So if you click on that daily health screening, you get this screen that says, please complete it before arriving or interacting on campus. So students, if you live in campus housing, do it before you exit your housing space, whether it's your apartment in the village or your room in the residence hall. When you click submit, you're going to first be asked whether or not you have any symptoms. Now there's actually more than that list of 6 or 7. So you'll need to actually scroll down to see the full list. In this case, I've checked that I'm not experiencing any symptoms. When I hit next, the question asks about exposure. Have you been in close contact with anyone that's tested positive within the last 14 days? And in this case, I clicked no, hit next, and it verifies that I want to submit this. So if you've answered any of them incorrectly, go back and change it now, because you won't have a chance after you hit submit. So because I answered no to symptoms and no to exposure, I get this message that says I'm all clear, but to continue to monitor symptoms. And if you start having symptoms, call student health. The key to getting the clear is this green pass. I'm calling it the green pass. This is what the faculty are going to refer to your daily health screening. They'll ask for a green pass. This is your pass to participate in classes, receive services, attend events. So you get an email as well that says you're clear. It's date specific. So your screening will last for the day. It expires at 11:59 p.m. each and every day. So if you want to opt out of the emails, there's this fuzziness that you can't read, but it tells you how to opt out. I don't care if you opt out of getting the emails. The main thing is we want you to get a pass for the day. Now in this case, I got green, but if I went back through the symptoms, and in this case, identify that I've now lost sense of taste or smell, and I've hit next, it will jump right to, do you want to submit this form? I hit submit, and I get this message that says stay home. So if you have any symptoms, that are COVID, they sound like COVID, you think it might be COVID, any symptoms at all, stay home. And the message there is call student health. They will help you determine whether your symptoms are truly COVID or if your symptoms are more because of allergies, because you've had allergies for a long time, or we're back in the basin and now the smoke is returning. Maybe you're having a reaction to the amount of forest fire smoke and it may not be COVID. So they'll help assess and then they'll tell you what you need to do. You will get what we're calling the red pass. That means you can't come to campus. You need to do nothing but call student health. And again, they will tell you what you need to do. They may tell you to go test. They may tell you it's not COVID. They'll clear you. You're good to do the screening again. So whatever you do, call student health first and they will assist. But if you get a red pass, you can't come to campus. All right, you'll get the same email, only this one's red. It says stay home, you're not cleared. Call student health. Special note here, do not try to go back and redo your screening. If you get a red pass, the only people that can clear the red pass is student health. So don't try to go back and resubmit answers in hopes of getting a different outcome. Only student health can clear that for you. All right, so summary for the daily health screening. Please do it every day. Please really stop and seriously assess if you have any symptoms or recall if you've had an exposure. If you get the green pass, that's great. Your faculty may be asking you as you enter class to show your green pass, or at the start of class, they may ask all students to hold up their phone showing their green pass. If you get something other than a green pass, do not come to campus. Do not leave your housing space if you live on campus. Please call student health immediately for instructions. If student health tells you you need to isolate or quarantine for a period of time, then please do it for the entire amount of time. 5 days is not the same as 7 days. So don't return 2 days early. We notify staff, faculty, how long you will be out. So if you return to class a couple days early, they may ask how that is and why you're there. So don't cut that isolation or quarantine period short. This flow chart will be sent to all students probably tonight or tomorrow. I'm not going to go through the step by step, but I encourage you to print it and put it somewhere where you can easily access it. So if you put it on your bathroom door, the back of your front door, put it inside the notebook that you carry all the time, wherever you want to put it, just know where it is so that you can find it in case you need it. And you'll need it if when you do your daily screening, you get a red pass, then it tells you contact student health, the phone number. The student health director will ask you if you want me as the dean of students to notify your faculty members that you were out. You can say yes, in which case I'll send out that message. If you say no, I'll take care of it, that's fine. You can indicate as much as you want to share with the faculty members about why you're going to be out of class. If you're asked to go test, that middle box will tell you for Klamath Falls where to test. There is a Portland Metro version of this that will be sent to Portland Metro students as to how to find a testing location. Then it tells you anything about isolation and when you can return to class. So again, print it, keep it somewhere where you can have it in case you need it. Let's shift gears a little bit and talk about what things will look like. Some of these are regardless of campus location, and some are specifically Klamath Falls. So in terms of the academic areas, we're concerned about classes and labs. So there's a couple things relative to those spaces. Please follow instructions of faculty. They may ask you to wipe down your work surface prior to the start of class or at the end of class. That's one of those keep it clean things. So listen to the faculty and do as they ask. Because face coverings are required in any indoor space, in order to maintain face coverings on properly, which means over your nose and mouth, not worn as a chin strap. We're saying no food in labs or classrooms. and the library just announced today that they're not allowing food in the library. So you can have beverages, coffee, water, whatever, but only remove your face covering in order to take a sip, and then replace the face covering properly, again, over both the nose and mouth. Faculty office hours, they're being asked to conduct office hours in person. However, if a student requests some alternative way of meeting with the faculty member should be able to comply either via a Zoom meeting link or a Teams meeting or a phone call, whatever works for you as the student. If you're out because of COVID, you need to reach out to each individual faculty member to talk with them about how you can stay connected with the class. It will vary from instructor to instructor. Some may be recording lectures, and you'll be able to get access to the recorded lectures via Canvas. Others will send you a remote connection. Some others will say, oh, you're only missing a day or two, talk to me when you get back. Whatever they work out will be on an individual basis. So make sure you reach out to them directly. All right, student organizations, clubs, they really missed out last year in wanting to do things. So this year, we're allowing student clubs to meet in person. Activities, however, will be approved based on the type of activity. Is it indoors or outdoors? The number of participants, some of the other details around it. What is our current status of COVID cases? So if an event is approved and it's 2 weeks prior to the actual event, it still may get canceled at the last minute. So be flexible, look for current information as to what's happening with activities, either through the app or emails. Again, all of our campus offices are staffed and open and ready to assist you in person, but they may ask you for your green pass before they want you to come into their office space or near their desk. So again, have those green passes ready and available to show. A couple of Klamath Falls specifics. Tech Rec, we know, is our new student recreation center. They are open. In fact, they opened today when they thought they would wait and open on Wednesday. They actually opened this afternoon. They are adhering to extra cleaning protocols. They may still limit the number of people in there. As you enter the Tech Rec space, look for current signage to give you information about how it's currently being operated. Those of you that are returning, you'll be happy to know that campus dining is fully open with all services, meaning you will be able to get your hot sandwiches and individual pizzas again in the bistro. You will be able to sit in the dining space once you go through the marketplace. It's back on china and real silverware. We're going to save $7,000 a week in paper products by not having to-go options. Other venues are open. The new Owl Express, which is where Subway was, is three kind of menu choices that will rotate. Right now it's the Farmer's Field. It's a build your own salad. There's two other options, a noodle bowl, which is pho nam, and then a Mexican option, which is called Serrano's. So those are all open and functioning. For student health, they're not doing walk-ins, so you will need to call for an appointment. And then when you go up for your appointment, you'll have to call to say that you're there. They'll do a couple of questions over the phone, COVID screening related, and then open the door for you to go in for your appointment. So please call for an appointment in advance. Of course, if it's a crisis, call, but they'll have you come right up. The bookstore is open, no limit on the number of people in there at a time, but with reduced hours, and those are posted just outside the gate. All right, let's talk about COVID testing a little bit. Last year, we did testing for students on campus. Fall term, it was 2 days a week, and then it dropped down to 1 day a week. That was through a partnership with Sky Lakes Medical Center. This year, they're saying they don't have the capacity to do that for us. So right now, the only testing option is the drive-through option, which is a couple blocks southwest of campus. It's walkable. They're open Monday through Friday, 8 to noon and 1 to 4. We ask that you take your insurance card, even though right now nobody's being charged. The important thing when you go is to tell them that you're an Oregon Tech student. By telling them that you're a student with us, the results will go right to student health, which will speed up getting your results back to you. And if you're negative, getting you back into classes and activities on campus. We are looking at some other testing options. We may be requiring testing for unvaccinated people on a regular basis. So as that rolls out, again, make sure you're staying current with our COVID response and reading emails, watching for information to be shared so that you're current. If you're not in Klamath Falls, there's easy ways to find testing locations. You can Google it. Most are zip code based, so you can find one close to home and not necessarily close to the Portland Metro campus. I've already covered, you need to contact faculty about staying connected with class when you're out. Please pay attention, respond to student health. If they call you and leave a message to call them back, please do so quickly. If you call them and you get a message, please leave your name and phone number so that they can return your call promptly. All right, let's talk about accountability. You know, last year we had the face covering requirement, I think the entire year, and yet only on 4 occasions did I actually have to meet with students to talk about how and why they couldn't wear a face covering properly or consistently, or they didn't respond when somebody asked them to put it on. So just 4 incidents of that. If that is needed this year, then I will be reaching out to students to come and have a chat with me. Failure to meet any of the COVID requirements or expectations could be considered a violation of the student code of conduct. And then consequences could be anywhere from a conversation and a warning to even suspension or expulsion from campus. So bottom line is follow the rules. Let's do what everybody is, what's expected of everybody. And we'll all be in a pretty good shape for the year. Last year we used the Stop the Spread pledge. It's currently, it was revised only to add information about the vaccine. They're posted around campus. Really the bottom line is that if we each make an effort to do our part consistently, day in and day out, we will be able to offer more of a true college experience, in-person classes than what we were even able to do last year. So I think you all are very able, and I have no doubt that you will help us in doing our parts to maintain the health and safety, the welfare of all of us, students, faculty, and staff combined. So here's the website. If you're looking for more information, I should also mention that there's a vaccination dashboard on the site. Currently, of those that have complied with the vaccine requirement, students are about 74%, and faculty staff are at 83% of being vaccinated. So again, if you haven't complied with the vaccine requirement, please do so immediately. All right, so be patient, be kind to one another, make good decisions, especially off campus when it comes to being safe and doing your part to prevent transmission, exposure, sharing, those things that we really don't want. All right, so I think, yep, that was the end. Let me stop sharing my screen so I can see the chat, and I can see if anybody wants to unmute and ask me a question directly. All right, so a question is, and we do this every time we come to campus. So I'm assuming you're talking about the daily health screening. So yes, before you come to campus, do your screening, you get a green pass, come on to campus, you get a red pass, don't come on to campus, call student health. We talked about COVID testing on campus. So I think I answered that one. Last time I did the session, I wasn't seeing all of the chats. So let's see, it looks like, what if we have a roommate and need to quarantine? So if you're living on campus, we will do two things. One of two things. First, we'll ask if you have an option to return home for your quarantine isolation period. It's a better experience for you. You get a little more TLC. If you're able to still connect with classes, that's great. If you say no, you can't return home, then we have spaces set aside in both the village and the residence hall for quarantine and isolation spaces. And then we'll work with you to get your meals delivered and assist you with other needs as they arise. Last year, we had 124 students over the entire academic year move in and out of isolation or quarantine. I shouldn't say 124 students. There were a couple students that did it more than once. So 124 times where we had students in isolation or quarantine. So again, could have been worse, but I think we did pretty well overall. How is Thanksgiving / winter break being handled in regards to COVID? So right now, the plan is to follow the printed academic schedule for fall term, which is to end final exams the middle of December, and classes return in January. I think it's Monday the 3rd or the 4th. It's right after the first of the year. So whatever that Monday is, we'll return in person. Now that's today's plan. I should always say that COVID might have a different plan. So if we need to change the academic plan and finish the term like we did last year remotely, or delay the start of winter term, we may do that. So it's, again, really important that you monitor all of the email communications. Email is our official means of communicating with students. So be sure to monitor, check your email regularly. Don't forward your OIT email to another email provider, because often it will go into spam and you'll likely miss some of those important messages. All right. Anybody else seeing any other questions in chat? It looks like my chat's working and I've covered them all. Any other questions that I can answer? If you want to unmute and ask, that's perfectly fine too. Okay, so if you have your name fully visible, that's great. If not, put your full name in the chat so I can make sure to give you credit. Otherwise, you're free to go. I will stay on just a little longer to answer any other questions. So there's a question about classes starting on Wednesday. If there's a class that's on Tuesday, you won't have your Tuesday class this week. You won't start Monday and Tuesday classes until next week. So on Wednesday, you'll attend your Wednesday classes. That's the way it will be.
What about if you have lab on like Saturday, but no class that week?
Okay, so you would have a Saturday lab this coming Saturday as your first time. But then,
Right, cool.
Unless they send you a message that says lab won't start until Saturday, the whatever day that would be, I don't know, not the first Saturday, but the second Saturday. So watch for your email. Some instructors might send that type of message, or they might have a lab prior to the lecture. It's really class dependent.
All right, thank you.
You're welcome. Anything else I can answer? Looks like everybody's putting their name in the chat. That's great. Thank you. If not, we'll see you on Wednesday.